People with bipolar disorder experience episodes of low mood, called depression, and episodes of elevated mood, called mania or hypomania. Compared to adults, children and teenagers with bipolar disorder tend to experience more quickly changing, complicated mood states. They may experience down and elevated symptoms at the same time, or sometimes have a range of moods even within the course of a single day. This can make it difficult for youth to understand their own experiences with symptoms and can mean it's especially challenging for them to discuss mood episodes with family members or a treatment provider. Mood charting is a way to track symptoms over time and learn more about a person's moods. By consistently gathering data about daily mood symptoms, both patients and their providers can better understand the patient's experiences with bipolar disorder. With mood charting, we're not interested in tracking each emotion that comes up over the course of the day. Emotions are things like worry, excitement, and anger. Emotions usually come and go fairly quickly, and most people have lots of different emotions that they experience over the course of the day. Instead, with mood charting, we want to track an overall mood state that someone has had for most of a particular day. Examples of mood states might include feeling down, feeling fine, feeling good, or feeling really energized or manic. For children and teens with symptoms that change especially quickly, it can be really challenging to pick just one daily mood. A person might have a day where they felt different moods at different times, or even multiple moods at the same time. As best we can, when we're mood charting, we want to try and mark each day's experience, even if that means tracking multiple moods for one day. There are different ways that people can decide to track their moods. Both paper and pencil mood charts and smartphone apps can be useful in gathering this daily information. Patients should use whichever option helps them to remember to log the data most consistently. It can be helpful to experiment with different options in order to find the method that's best for keeping daily track of moods. We'll start by first talking about paper and pencil options for mood tracking. Paper and pencil mood charts can be quite simple. Here's an example of a weekly mood chart that someone could fill out just by circling a number on the scale for each day of the week. To help with completing these charts each day, some people like to place them somewhere that will consistently grab their attention, like a bedside table or taped to a bathroom mirror. Many people like to create their own mood charts and use their own labels for describing different mood states. If someone prefers not to use terms like manic or depressed, there's nothing wrong with using different words for these experiences. What's most important is improving awareness about these different mood states and developing an expertise on catching any changes in mood. Here's an example of a mood chart that a teenager created for herself, tracking changes in mood over the course of the week, as well as other experiences, like feeling tired, having anxiety, or being irritated that went along with these moods. Lots of kids and teens prefer to track their mood on smartphone apps instead of using a paper and pencil, and there are plenty of great options for doing this. Apps like Dailyo, Mood Panda, and Moody are simple and especially easy to use. Apps like iMood Journal and eMoods can log not only information about mood, but also data about sleep, activities, and other symptoms like anxiety. After going through all of these different ways someone can log their mood symptoms, you might ask the question, why keep a mood chart? Why do people track their moods? Mood charts can help people improve their awareness of their experiences, which puts them in a better position to respond effectively to any emerging mood episodes. It's generally much easier to treat mild symptoms rather than severe symptoms, so we want to respond to mood episodes as early as possible. This requires developing an expertise in knowing the earliest signals of a new mood episode. Many times, family members may have difficulty understanding or recognizing a patient's mood changes. If teens and children decide to share their mood charts with family members, it can help start a useful conversation about symptoms and improve levels of family support around these experiences. Mood charts can help identify triggers that worsen your mood, like shifts in sleep, increases in school stress, or conflict with family members. The more you know about your triggers, the better able you are to respond to them. And finally, treatment providers will find the mood data very useful in their work. It's a way to learn more about a patient's unique experience with bipolar symptoms and also determine if their interventions, like psychotherapy or medications, are working. It can be difficult to get into the habit of charting your mood, especially when someone is just getting started or they're not having many symptoms and it feels like there isn't a whole lot to track. Other times it can feel like a mood chart is overly simplistic, either that you can't accurately capture the full complexity of the experience with symptoms, or that it's too difficult to log all of the different variables that could play a role in how someone's feeling. That being said, the benefits of mood charting mean that for most people, it's worth giving it a try. Here are some tips to help you get the most out of mood charting. First, try to fill out your mood chart at the same time each day. For most people, it's most effective to save a few moments towards the end of their day to track their mood. It's best not to pick the worst moment of the day to fill out your mood chart, as this may not give the most accurate picture of overall mood. It's okay if you forget to fill out your mood chart before an appointment with your provider. Rather than trying to remember your mood from days or weeks ago and log it just before your appointment, it's a better idea to talk about the difficulties with charting with your provider. They can help you come up with a plan that may make it easier for you to do. And finally, keep a lookout for connections between changes in your life circumstances and changes in mood. Developing a solid understanding of what makes you more likely to have mood symptoms or what makes you less likely to have mood symptoms is a powerful tool in learning how to manage bipolar disorder. While it can sometimes be a bit of a challenge to get into the habit of mood charting, it can be an incredibly useful tool in developing an expertise in understanding symptom patterns and learning what works best in managing mood symptoms. We strongly encourage kids and teens who have a bipolar disorder to try out some of these mood tracking options and see if you might be able to find something that works for you. You can find more resources to help out with this on our website.